Hello everyone, and thank you for joining us. Today, we'll explore together how data and artificial intelligence is revolutionizing elder care. I'm honored to be your moderator for this conversation between Anne-Charlotte Dymny. So welcome, Anne-Charlotte. You are the Chief Digital and Information Officer at CLARIANE, so the leading European community for care, healthcare, and hospitality in times of vulnerability. And Adeline Martin. Welcome, Adeline. You're a project coordinator at MEDES, the Institute for Space Medicine and Physiology, dedicated to promoting the application of space research for healthcare. I'm super excited about this conversation between the two of you, which most likely might appear counterintuitive for our audience, and it's going to be fascinating to learn more about the common grounds that your both companies share when it comes to innovating for a better aging. Just to kickstart the conversation, let me start with a few simple statistics. Today, 20% of French people are aged 60 years old or beyond. And this number is most likely to increase up to 33% by the end of 2060. Life expectancy for at birth in 2023 for women is around 85.7 years old. And it turns out that, on average, women have 63, 64 healthy life years, meaning that most of women in France are living or will live with roughly 20 years spent in a position of vulnerability or loss of autonomy. So my first question for you, Anne-Charlotte, is can you let us know a bit more about CLARIANE's mission? How do you see the evolution, this recent evolution of aging, and what is your reaction to those statistics?
Thank you very much, Thomas, for welcoming us in such a nice and insightful event, and for your question. And actually, I will take them backwards. What strikes me in your statistics is that you're talking about France and the French life expectancy. And it's true to say that in France, our life expectancy in good health is less good than in Spain, for instance, or in Latin America. And actually, at CLARIANE, our main question is how can we, as a company, help to increase this life expectancy in good health? So I'm sure that many of you think that you do not know CLARIANE, but actually you do. CLARIANE is, as you said, the leading European company for care in times of vulnerability. We have rebranded our company 2 years ago. It was formerly known as CORIANE, so now I'm sure that everybody knows about it. We are a community of more than 60,000 professionals taking care of around 900,000 patients and residents each year in 6 countries across Europe. So in France, in Germany, in Italy, in Spain, in Belgium, and in the Netherlands. And why did we rebrand our group? Is that because CORIANE is known as an elderly care company, like a brand for nursing home, and this brand still exists. But we do have other activities. We are taking care of elderly in nursing homes, but we are also taking care of elderly or not elderly in clinics for rehabilitations. For instance, if you have a surgery for your hip or your knee, then you can come to our clinics for education, and also for mental health. And in Italy, we also have clinics more like for acute care. And the third segment is, as you said, hospitality, is like new form of accommodations for the elderly, so collocations, for instance, for seniors, and also home care services. We have also rebranded, and at the same time, we have transformed into an entreprise à mission, a purpose-led company. And our mission is to take care of each person's humanity in times of vulnerability. This mission relies on 5 major commitments to the society at large: consideration, fairness, innovation, sustainability, and proximity. in this order, actually. And that you can see that the third of them, like really at the core, we have innovation. Because we are really convinced that everything go through innovation, and this is the cornerstone of the medical progress. So when I say it, it's obvious. But this is also the cornerstone to address this question of how do we increase the life expectancy in good health. So technology is, of course, one of the answers. Data is one of the answers. But not only. Technology will help us to change the way we care for people. Coming from a very acute care, like I'm sick, I'm going to the doctors, or I'm old or too old and I'm going to the nursing homes, to something much more on the prevention side. And that we will take care of the elderly not when they enter our nursing homes, but much before, because thanks to technology and the leveraging of data, we would have been able to design care pathways for more preventative, I would say, care. So that's the first thing. And the second thing is indeed prevention focused on the frailty, the fragility, the vulnerability of our patients and residents, and how do we preserve as much as we can the autonomy of the elderly. And we have been discussing for years now, but this is becoming more and more concrete, the integration to worldwide programs designed by the WHO, known as ICOP. But I will stop there, and we will tell you more later on about this program.
Thank you, Anne-Charlotte. And indeed, for our audience, the ICOP program is intending to supporting people aged 60 years old and beyond, particularly the most vulnerable among them, with support in assessing 6 essential functions, being locomotion, nutritional status, mental health, cognition, hearing and vision. So in order to accomplish your vision and your mission and better serve patients in needs, I understand that it means looking for aging better as opposed to aging more. Can you give us concrete examples of how CLARIANE is supporting research in this domain, Anne-Charlotte?
And everything starts with another question, like, what does aging mean? You can be 80 and in a very good shape, and you can be 50 and in a very bad shape, and have the body and the health of an 80-year people. So indeed, we want to age better. And we have a holistic approach of this healthy aging. As you said, ICOP, focused on many different functions that we all have, instead of focusing on one particular disease or one particular organs. So that's why we liked very much this WHO program, because it is also completely aligned with our philosophy of care, which is called positive care. Like, we are taking care of a person, right? We are not taking care of a disease. So we have identified this health dimension, and we are working more and more on the personalized care and on the personalized life plan of each resident and patient when they come to us. And on top of that, this is something that we are trying to set up within our own facilities, so very concrete, like live. And on top of that, we are also investing in research, leveraging, as I said, our wide based in Europe of more than 1,000 facilities in our 6 countries. So we have 2 issues of research. The first one is on fall detection. Some figures around falls. So this is the leading cause of fatal accidents among the elderly. This is the 3rd leading cause of admission to acute care. So if we can relieve the emergency room of elderly falling, that would be also something very good. And something very interesting is that when you're an elderly and that you fall, you will end up into a nursing homes 30 to 40% of the time. So that's why also this is really important to work on a prevention and prevention of fraud. But to understand everything behind it, so we have launched these big research programs, gathering data from over 56,000 residents in France and in Germany. We have already identified more than 200 variables per resident. And we do hope that we will develop a meaningful prevention algorithm based on all this. The second project is a bit different, still focused on elderly people, but more on what we call gerontopsychiatry. So it's focused on mood disorders and depression. Here again, you might be surprised to know that 40% of the nursing home residents suffer from depression. And depression is actually the leading cause of suicide among the elderly. So our project OSIRIP aims at improving the skills of our care professionals in nursing homes in detecting this mood disorders issue among our residents, because this is not what they've been taught. And this is something very new and surprising. So today we have, and we are speaking about big data here, and I guess that AI could completely apply. So we are talking about 1.6 million raw data gathered from 100,000 residents in 3 countries. And we are analyzing it as we speak. Here also to design a tool to detect depression among our residents.
Thank you, Anne-Charlotte, for sharing. This is, I think, very insightful to find out that CLARIANE is concerned by both the physical and mental aspect of aging. Maybe turning over to you, Adeline. Research on Earth is one thing, but can you let us know the kind of research MEDES is supervising, and in particular, what those space can teach us about aging?
Yeah, thank you very much. You might question why we are here as an institute working on space medicine and space agencies. So maybe you know that we select astronauts because of their perfect, let's say, health. But you might not know that going into space takes a lot on the body, and they have a lot of physiological consequences going there, that what we are calling actually accelerated aging, but that is reversible when they are coming back to Earth. So one of our missions is to work with space agencies and researchers to understand what we can do to help them be there without consequences, or at least the less consequences possible, and how we can help them readapt when they come back to Earth. So you've probably seen videos of astronauts doing exercise, or you've seen maybe the food that they are eating. So the goal is to understand how exercise, nutrition can prevent this aging that they are experiencing in space, and everything that we do for them, how we can translate it for Earth application. Because what they are experiencing is like they're losing bones, like you can when you have osteoporosis. They lose muscle mass when you have sarcopenia, for example. So there's a lot of pathologies that they are experiencing that are actually experienced by people on Earth, and mostly they're linked to hypersedentarity pathologies, and a lot are found in seniors people. What we are also doing is doing that, but not on the physiology level of patients, but also on the cell levels. And we are helping researchers conduct experiments aboard the International Space Station, where they can understand, thanks to the space environment and the microgravity conditions, understand how the cells behave, how this mechanism is working, so we can identify mechanisms or pathway to prevent this aging of at the cellular level, and to understand maybe how it works on Earth, and then try to identify how we can prevent that on Earth.
Thank you, Adeline. That's really fascinating. I think you both highlighted areas for innovation, and Anne-Charlotte, you were referring to the WHO previously, who is emphasizing in one of its recent studies the need for early screening to adapt prevention. So why is that, and what is your conviction at CLARIANE on this particular topic of early screening?
So indeed, we do think that the future of healthcare is all about prevention, and as you said, with early screening, to design really personalized care pathway based on the results of these early screenings. And this will make us able to anticipate much more the frailty and to also reduce hospitalization and the burden, you know, of healthcare costs on the overall society at large. So that's why we have entered into this ICOP program, so the WHO program, together with the EHU of Toulouse, and also with the MEDES, but I will let Adeline talk more about that. We have really started. We have 3 ongoing pilots in the south west of France in our clinics, and also with the network of home care agency Petit Fils that we have. We are offering them to take some these screenings to see whether or not they have frailties and how we can care for them, and this will allow us to be a bit more predictive, and also to be a genuine partner of the local health authorities in the different territories where we are implemented.
Yeah, and another synergy that we have is that we are also working on the ICOP program. Because we have a lot of experience in following the health of, monitoring the health of astronauts, we are used to develop tools to help us track it, to help us track their nutrition, their exercise. We know to handle the data of all of that. So we are working with the Toulouse University Hospital, and we help them develop actually the ICOP tools. So we are not doing the research, but we help them on the technical side to handle the database, to handle the questionnaire, to handle the technological tool that practitioners are using to enter and track patients. So it's not completely our core activities, but because we have this experience, we can work on this program as well.
So definitely interesting common grounds between you both. So scaling such initiatives and preparing the future of longevity definitely comes at some cost. So my last question for both of you will be, how can we make this transition towards preventive care happen at scale or in a sustainable way? What solutions do you envision? What are the potential roadblockers that you've encountered, either for us as a society or for your particular company?
I like what you said, like at scale, in a sustainable way. Well, at scale, obviously, the answer is technology and data, of course. And in a sustainable way, well, I think there we have still some work to do to collectively design, I would say, a framework, a regulatory framework, but not only, that finds the right balance between protection, regulation, privacy, to really protect them, and also make sure that we are always doing things in a very ethical way. But this framework should not stifle innovation. And lately, I've been a bit afraid that we might have gone a bit too far within the protection, and at least in Europe, and that the space for innovation is a bit difficult to find.
And on our side, I'd say the roadblocker, the main pain point is the data, because then we are working with really small cohorts of patients and astronauts, and then we want to use this data to be able to do more things, and so we need new technology to help either create synthetic data or help us enhance our already existing data.
Thank you, Adeline. Thank you, Anne-Charlotte, for this fruitful conversation. I hope you enjoyed, and I think we are running a little bit out of time, but do not hesitate to reach out to us should you have any question right after. Thank you very much.